And if you've got someone in the chair, if you're in the healthcare field, you don't just do stuff. You have a diagnosis, and your diagnosis drives your therapy. The definition of diagnosis is the nature and cause of a disease or injury. It's always twofold. A long time ago, Barry, we'll see tomorrow, is a wizard at identifying the nature of a disease or injury. And in our field, what's the status of the joint? Where's the disc? Is it folded? Is it wiggly? Is it degenerative? That's the nature of this, what you're looking at. Then there's the cause. How did it get that way? How did it stay that way? We used to have this really interesting comparison of a guy with a broken leg who comes into the ER with a broken leg. What's the diagnosis? Barry would say, what's the diagnosis? It's a broken leg. That's a diagnosis, I'd say. And they take an x-ray of it, and they find their bone marrow's all eaten up, and did they ask how you broke your leg yet? Was it in a car accident, or were you walking downstairs and it snapped in half? Because you've got bone marrow cancer. Is the diagnosis now a broken leg, or is it cancer with the presentation that you've broken your leg? It changes the treatment entirely. So you've got the nature of the disease, this guy's got a broken leg, and the cause, or how it got that way. So when you're making a diagnosis, although you're not identifying normal anatomy or physiology, it's your knowledge of that how it allows you to arrive at your diagnosis, because you don't have this. There's something different about the anatomy that's not normal. There's something about the physiology that might have been going on that makes the patient not normal. There'll be either some abnormal anatomy or there's a pathophysiology. In the joint, we've got abnormal anatomy. Some people have abnormal joint anatomy and they're fine. There's no pathophysiology there to make them symptomatic. Sometimes their joint is perfect, but the patient is miserable. There's a pathophysiology that makes them miserable while the joint's fine, and there's going to be a combination of the two. So you see anatomic deviations, subjective reports, and whatever it is that got it that way, sometimes there can be a trauma, and after a trauma, most people heal. Now we'll see patients that are telling you about their condition, their headache or whatever, and they say it was from this auto accident in 1983. So, God, you're not better by now? What is it that's keeping you that way? I know how you got that way. How come you're staying that way? Purposeful function is going to obligate necessary form. There are things that you're going to need to do in mastication, and you will be obligated, you have forms that allow for it. It happens all across nature. If you have the need to capture another animal and hold on to it, you have really long canine teeth. If you have a purpose or a need to chew corn or grass, you have big molars and big masseters. So your purposeful function will obligate the forms that you need to perform that function. Those forms will allow you to do things you don't need to do. You can do weird things with your jaw and with your teeth that there's no purpose, there's no function, I'm going to use the term function as mastication. You can do things with your teeth that they're not meant to do, but you can do them. You'll be doing a purposeless function. The more purposeless function that happens will dictate the altered forms. All of a sudden, now your forms don't look like that they need to. They're an adaptation from your purposeless activity. Sometimes your altered forms will modify what you're trying to do. If you've wiped out your teeth, it makes you chew differently. But you can modify, you can adapt. Nowhere on this screen is anyone complaining yet. There's no signs and symptoms up here. This is just how it works. Once there's signs and symptoms, the practitioner starts to make determinations based on his experience and his education on what he's going to do to treat that patient. Some will say your function is improper, and they'll do a lot of measurements and a lot of recordings, and they'll say, see, your muscles are working improperly during function when you're chewing food. We need to treat your function. They never give any other mind to anything else. Sometimes they look at the altered forms. It's those forms that have caused your signs and symptoms. You see that joint? It's not seated properly. See how that disc is folded over? You see how your teeth are wiped out? We have to treat those forms to make your signs and symptoms go away. Or we have to treat the way you function. We're going to change your teeth so when you chew food, you chew differently. I think it's been over here this whole time. But this is what's easy to see. That's easy to record. So we treat those things and we get success. It's perfect. And when you don't get success, at least you got the fee and you move on, you feel bad about it, but you don't talk about it.